Hello all, welcome back to my channel Lemon Tricks, where concepts are made easy. In this video, we are going to see the last part of the unit Healthcare Delivery Systems. In the last video, we have learned about various healthcare agencies. So now let us learn about hospitals. What are hospitals and what are different types of hospitals available in our country? So the word hospital is derived from a Latin word, hospitalis. Actually, it is derived from a French word hospice that means a guest or a host. So the Latin word hospitalitas refers to a place where guests are received. So according to World Health Organization, it states that the hospital is an integral part or an important part of social as well as medical organization. And the main function of the hospital or the responsibility of the hospital is to provide the complete health care. So it includes both curative as well as preventive care. Curative in the sense curing the disease, preventive in the sense to avoid or take prompt action against the disease. Now let us look into the types of hospitals or classification of hospitals. Hospitals can be classified in many ways. The first way is according to the ownership or control. It means on the basis of the ownership or control, the hospitals can be divided into various categories. So here the first one is public hospitals or government hospitals. So these are the hospitals which are owned by the central or the state government, or we can say it is owned by a municipal or a local body on a non-commercial basis. So these are the hospitals may be called as general hospitals or specialized hospitals, or sometimes even the both. General hospitals are those which provide treatment for common diseases, whereas specialized hospitals provide treatment for specific disease. For example, there are cancer centers to treat cancer, hospitals for eye, hospitals for cardiac disease, children's hospital, and so on. And the second type under this ownership is the voluntary or charitable hospitals. These are established and incorporated under the Societies Registration Act. So here a board of trustees usually manage the hospital, and the main source of revenue are the public and the private donation, and also sometimes grants and aids from the central as well as the state government. And the third one is the private hospitals. So these are generally owned by individuals or group of people, and these purely run on commercial basis. And the last one is the corporate hospitals. So these are run by the public limited companies. So these are being formed under the Companies Act. And here also there can be general corporate hospital as well as specialized hospitals, or sometimes even the both. The second type of hospitals are classified according to the length of stay. So according to the length of stay, the first type of hospital is a long-term hospital. It is also called as chronic care hospitals. So in these hospitals, patient may stay for a long period of time. So the disease may be chronic in nature, so that patients require a long-term stay. The best example is like leprosy hospital. And the second type is the short-term hospitals, or this is also called as acute care hospitals. So the client may stay in the hospital for a short period only. So for example, if they are suffering with a fever or gastroenteritis, they get admitted for 2 to 3 days and get discharged. And the third type is the daycare hospitals. So these are the hospitals where the patient comes to stay from morning till evening, as the members of the family may not be available at home to take care of this sick. The third type of hospital is classified based upon whether it is teaching or non-teaching hospital. So teaching hospital will definitely have a medical, nursing or paramedical college or school attached to it. So usually research activities are carried out in these institutions. A hospital without a medical college or a nursing college or a paramedical institution is termed as a non-teaching hospitals. Sometimes even research activities may be carried out in these hospitals also. And the others like the hospitals are divided based upon the clinical specialities. For example, women and child hospital or regional cancer center, eye hospital, tuberculosis center, maternity hospital. So based upon the specialities, the hospitals are also classified. Now let us look into the functions of a hospital. As I've already stated in the definition, the primary function of the hospital is to provide curative as well as preventive services. But the role of the present day hospital is mainly divided into two distinct functions. Like the first one is the intramural function and extramural function. So the first one is the intramural function. The first function of the hospital is the intramural function. So these are the functions usually found within the hospital itself. So in the hospital, the first intramural function is providing therapeutic care. Under the therapeutic care comes the first function called as the curative care. So it means to provide cure or treatment for all the disease condition. The second one is diagnostic services. It means to provide the diagnosis or in order to help the patient to find out the cause or the type of diagnosis. And the third one is rehabilitation services. So facilitating physical, mental, social and occasional rehabilitation should also be available in the hospital. And the last therapeutic care is care in emergencies. So assisting the client in restoring health, especially in accidents, trauma and also in acute life-threatening conditions. And the second intramural function is rendering preventive care. So preventive care can be provided through antenatal or postnatal services, well baby clinics and immunizations, also family welfare services, control of communicable disease and also providing health education. And the third intramural function is education. Hospitals attached to training institutions usually provide education to students such as medical education, nursing education, paramedical training and also community health training. And the last intramural function is the research. So research in various areas of medicines as well as in nursing are conducted in the hospital setting. The second function of the hospital is the extramural function. Extramural activities are the services which are performed by the hospital which radiate outside the hospital to the home environment and to the community. So it includes outpatient services. The term outpatient means someone who requires medical care but not hospitalization. So it includes taking a doctor consultation, performing diagnostic tests and so on. But they don't get admitted in the hospital. The second services under this extramural function is the health camps. So these are the camps held in the rural areas or schools or colleges by the hospital authority. And the next one is the home care services. So these home care services are the type of health services which are provided by the hospital at the patient's doorstep. And the next one is the health promotion activities. So these are done at the village levels by organizing certain national health programs such as control of TB, malaria, control of HIV, maternal health and child health programs. And the next one is the school health services. So it is referred to the need based upon the comprehensive services rendered to the students, teachers and also other personnel who are working in the school. And the main aim is to promote and protect their health and also to prevent and control diseases to maintain their health. And the last one is the industrial health activities. So these are the protection of health and safety of health workers, especially contributing to improve the productivity, job satisfaction and retention of health workers. Next, let us look into the departments in a hospital. So the first department usually which comes to our mind is the outpatient department. It is also called as OPD. So outpatients usually go to the hospital just for a diagnosis, treatment or a therapy and they leave the hospital without staying overnight. And the second department is the emergency or casualty department. It is usually located in the area which is easily accessible to the patient. So emergency department should always have sufficient medical as well as nursing personnel, supplies, equipments and facilities for meeting any sort of emergency situation. So usually victims of an accident, patients with cardiac arrest, patients with breathing difficulty and emergency conditions are quickly brought into this casualty department. And the third department is the inpatient services or the inpatient department. Patient who requires continuous medical care and attention are admitted in the hospital and they stay overnight or for several days or weeks. And the next one is the nursing department. So this department consists of nursing services as well as nursing education. So the next one is the paramedical departments available in the hospital. It includes laboratory, so where various investigations are carried out in the laboratory, such as blood, urine, feces, CSF, body fluids. And laboratory also have different sessions as hematology, biochemistry, bacteriology, parasitology, pathology, and many more. And under the paramedical department only there comes the radiology department, where X-ray, CT scan, MRI scan, sonogram, etc. are being taken place. And the third one is the dietary department. This department mainly meets the dietary requirement of the patient. Especially diets are served depending upon the disease condition of the patient. For example, salt restricted diet or fat restricted diet or bland diet, diabetic diet. All these diets are modified according to the needs of the patient. And the next one is the pharmacy. This department is responsible for the selection, purchasing and storing, preparation of drugs and others. And other departments which we see in the hospital are the administration and accounts. Usually this is vested mainly upon the group of people, or depending upon the hospital superintendents or the department heads and so on. And the next one is the housekeeping. The main function of the housekeeping department is to keep the hospital clean. And maintenance department, which usually carries out all the maintenance work in every department. And central supply department. The responsibility of this department is to prepare and furnish equipments and supplies needed for patient care. Next one is the laundry department. Taking care of the entire linen used in the hospital is vested on this department. And the next one is the Central Sterile Supply Department, CSSD. So this department will supply sterile articles throughout the hospitals depending upon the hospital policy. The unsterile articles are received, washed, dried, packed and sterilized, and also distributed to the various departments which are in need of the sterile equipments. Let us learn about the healthcare team. So team means a group of people, right? So here the team includes a group of professional people usually come together to assist or to help the patient depending upon their healthcare needs. So here in the healthcare team, the first member would be the medical officer or the physician. So usually they are responsible for the medical diagnosis, and they usually prescribe the treatment or the therapy for the patient. And the next one is the nurse. So here a team of nurses will be available in the hospital to provide care to the clients. And the next one is the physiotherapist. So they usually assist or help the patient who have musculoskeletal problems. And the next member in the healthcare team is the dietitian. So usually the dietitian provides education regarding the diet of the client according to the disease condition. And the next member is the social worker. Usually the social worker assists the clients in many areas of their problems like finance, counseling and accommodation. And the healthcare team also includes paramedical staff. So the paramedical staff includes the laboratory technicians, radiology technicians, occupational therapists, speech therapists and many others. And also the healthcare team includes the pharmacist. So these are the people who are responsible for the preparation and dispensing medications to the required wards or to the patients who are in need of medicines. So all these members together comprises the healthcare team. So this is all about the unit healthcare delivery system. If you found this video useful, kindly like, share and subscribe. Thank you so much for watching.